What if a diagnosis wasn't an end, but a radical beginning? In 2024, an actor who defined a generation of teenage angst revealed he was facing a battle that had nothing to do with Hollywood scripts. James Van Der Beek, forever known as Dawson Leary, announced he was fighting stage 3 colorectal cancer. But he didn't call it a tragedy, he called it a gift. A brutal, terrifying gift that forced him to rewrite his entire life's priorities. This is more than a celebrity health story. This is a profound case study in human biology, the silent rise of a preventable cancer among younger adults, and the neuroscience of resilience. Welcome to Health Inside, Anatomy in Science. I'm Dr. Your Name or Channel Host, and today we're using James Van Der Beek's journey as a lens to explore a critical, urgent question. Why are so many young, seemingly healthy people now facing colorectal cancer? And what does his gift teach us about the mind-body connection in healing? The unseen epidemic, colorectal cancer's alarming shift. Van Der Beek's diagnosis at 46 fits a terrifying and unexplained trend. Since the 1990s, the incidence of colorectal cancer in adults under 50 has been rising about 1 to 2% per year. It is now the leading cause of cancer death in men under 50 and the second leading cause in women under 50 in the United States. This isn't a statistical blip, it's a demographic earthquake. We are looking at a generation, millennials and Gen X, facing a disease their parents were told to worry about in their 60s. Why? The science points to a complex interplay. The microbiome hypothesis. The modern Western diet, high in processed foods and low in fiber, may be cultivating a gut microbiome that promotes inflammation and creates a carcinogenic environment. Environmental and lifestyle factors. Sedentary behavior, obesity, heavy alcohol use, and smoking are established risk factors that are prevalent in younger cohorts. The screening paradox. Because guidelines traditionally started screening at 50, cancers in younger adults are often discovered late, at more advanced stages like Van Der Beek's stage 3, when symptoms like unexplained weight loss, changes in bowel habits, or blood in stool finally force a doctor's visit. Van Der Beek's public advocacy is directly aimed at shattering this paradox. His message is clear: don't ignore your body's signals, and don't let age be a barrier to advocating for a colonoscopy. Decoding Stage 3, the biology of the battle. So what does Stage 3 mean in cellular terms? It means the cancer, which began as a polyp in the lining of the colon or rectum, has grown through the wall of the intestine and has spread to nearby lymph nodes. It is not yet metastasized to distant organs, but it is at a critical juncture. The lymphatic system, our body's drainage and immune highway, has become a pathway for potential spread. The standard treatment arsenal for stage 3 is aggressive and multidisciplinary. Surgery, colectomy, the primary tumor and affected lymph nodes are surgically removed. This is the cornerstone of curative intent. Adjuvant chemotherapy. After surgery, chemotherapy like Folfox or Capox is administered systemically. Its goal is to eliminate any microscopic cancer cells that may have escaped the surgical site, reducing the risk of recurrence. The emerging role of immunotherapy. For a subset of patients with specific genetic markers like MSI-high or dMMR tumors, immunotherapy drugs can be a game changer. These drugs don't attack the cancer directly, they remove the brakes on the patient's own immune system, allowing T cells to recognize and destroy cancer cells. Van Der Beek's choice to auction cherished memorabilia to fund his fight highlights a less discussed anatomy: the financial toxicity of cancer. The cost of cutting-edge treatments, supportive care, and time away from work creates a staggering secondary burden on patients. The gift, the psychoneuroimmunology of a cancer diagnosis. This is perhaps the most profound part of his story. How can cancer be a gift? To understand this, we must venture into psychoneuroimmunology, the science of how our thoughts, feelings, and attitudes directly influence our brain chemistry and, crucially, our immune function. A traumatic diagnosis triggers a massive stress response. Cortisol and adrenaline flood the system. Chronic stress of this magnitude can suppress immune surveillance. However, what Van Der Beek describes is a post-traumatic shift in perspective. By choosing to see the disease as a catalyst for self-love and presence, he's engaging in a powerful cognitive reframing.
This mindset can activate different neural pathways. Practices like mindfulness, gratitude, and prioritizing joy can reduce inflammatory cytokine production, promote healthier vagal nerve tone, which governs the relaxation response, improve sleep quality, which is critical for immune recovery and cellular repair. This isn't about positive thinking curing cancer. It's about the scientifically observable fact that a patient's psychological state can influence treatment tolerance, quality of life, and potentially therapeutic outcomes. His gift is the forced recalibration towards behaviors that may actively support his biological healing. The ripple effect, advocacy, and early detection science. Van Der Beek's platform has turned personal tragedy into public health action. His advocacy underscores the revised guidelines. Screening for colorectal cancer should begin at age 45 for average-risk adults. But what does screening actually look like? The gold standard, colonoscopy. This procedure allows for direct visualization and immediate removal of precancerous polyps, adenomas. It's both diagnostic and preventative. Non-invasive options. Stool-based tests like the FIT, or fecal immunochemical test, or Cologuard, which detects DNA changes, are effective for initial screening. A positive result must always be followed by a colonoscopy. The critical message: no test is perfect except the one you take. The goal is to find cancer early at stage 1, when the 5-year survival rate is over 90%, versus stage 3, where it drops to around 70 to 75%. His absence from the Dawson Creek reunion due to a common stomach virus is a poignant reminder. Even during cancer treatment, the mundane illnesses of life continue. The body's ecosystem remains complex and vulnerable. James Van Der Beek's story is a powerful fusion of celebrity and science. It highlights a silent epidemic affecting the young, demystifies the brutal biology of cancer treatment, and points to the profound, measurable power of the mind in the healing journey. His gift is a lesson in biological awareness, for him and for all of us. If this deep dive into the science behind a public figure's private battle changed how you think about cancer, resilience, or early detection, please give this video a thumbs up. It helps us bring more human-centered science to you. Share it with someone you care about over 45, or with anyone who needs a lesson in strength. Subscribe to Health Inside, Anatomy and Science, and hit the bell. We explore the stories where human experience and cutting-edge science intersect. Stay aware, stay proactive, and stay strong.